by really approaching each individual as a unique human being, living and making decisions under unique personal circumstances. So thank you for the opportunity today to really share our story with you. So Greg, if you'll go to the first slide. When it comes to healthcare, as consumers, we've largely been left on our own to really figure out some of the most complex, the most pivotal, most anxiety-provoking moments in our lives. And Accolade was a purpose-built company to really provide employees and their family members the tools and expert guidance to make those moments a little less uncertain. So our engagement and influence model is really designed to remove that consumer burden of having to navigate the healthcare system alone, and really to alleviate that frustration, that complexity of the healthcare process. And we accomplish this by providing everyone with their own personal health assistant and their own personal nurse. I often use the analogy that if you were sued, you would go get a lawyer to represent you in court because they know the legal system. But yet, as human beings, we are left on our own to navigate a healthcare need and understand what we should be doing and making the important decisions on the treatment we should be having. An important factor in making our model work is really getting to know who the member is. You know, which of our interactions are going to be more relevant, which more are going to be more trustworthy with that individual, because we know that healthcare decisions are impacted by really several things: how the member feels about their health, their confidence in dealing with their condition, their skill level, and really their motivation to address their health condition. It's estimated that 85% of decision making is really happening outside of the doctor's office, which means people are being left alone to decipher this complex, this fragmented healthcare process on their own. So Accolade is working with each member to understand their unique context, which helps us then coach. It helps us influence a member in making the right healthcare decision for them. If you want to go to the next slide, we all know, though, it starts with engaging that member. We've got to engage the member, we've got to engage their providers. And it's not just about that initial engagement. It's really about amplifying it through trust and through influence. And so we've built our engagement model that really allows us to engage with members 30 to 60 days before care is consumed. And we do that in several different ways, which I'm going to talk about today. We act on very early care signals that get generated when a member visits a provider. All of this data comes into our platform, and it draws what the outreach that we're doing and the personalization for our members. We make it really easy for members to reach us through a multi-channel access that includes a highly rated mobile app that our members really use frequently. In addition to that, we use all your healthcare data as an employer and apply intelligence to that data to identify the best time to reach out to a member. So maybe it's someone with a new diagnosis. They just got diagnosed with cancer or diabetes or asthma, or maybe they just had a biometric test and now they've got an abnormal cholesterol level or an abnormal blood pressure level. Those are great opportunities for us to reach out and engage with that member. And it's really that combination of this early engagement and influence that really draws the outcomes that we see far earlier. Then we add influence. Long-term, sustained, trusted engagement is very rare in our industry, and we feel like that is very much needed to really influence care and influence how people make decisions. And health plan carriers often struggle to engage members, and they struggle because members are hesitant to share important health information with their medical carrier. And Accolade, being an independent third party, is part of the answer, but it's not whole of what actually overcomes this burden. I think what is our secret sauce is establishing that trust and earning that member's permission to support their health journey. It's really what we do, and that's what we're set up to do. Next slide. So our integrated member portal really displays benefit information to the member, data-driven personalized recommendations based on their healthcare conditions, recent claims, medical accumulators, and really secure messaging history. So whenever they have message with their health assistant, their nurse, they can see that information. Where the traditional model often tends to treat everyone the same, we have personalized everything we do, from the portal that the member uses to the messaging app that the member uses. Our mobile app really provides that text-like secure messaging between members and their health assistant or nurse. It's very easy to use because everybody texts today. So it's set up to be the exact same kind of application. So it doesn't require a lot of learning of how to use it. The app can also be used as a virtual wallet to store and share any kind of cards, your insurance card, your dental card, your pharmacy card. So you can have that to share with providers. Just as we do via our phone conversations, our health assistants also influence members to use appropriate programs at the right time by using our messaging benefit that we have to help people know about different programs that you may offer for that member. So think of someone that might be looking at getting some healthcare, mental health care needs. Thinking about our promoting that EAP to them so that they know that this is a service that you can access through that mobile messaging app. These options all work seamlessly together. So a member uses a mobile app to click to call and can convert that conversation to a verbal one instantly. So if they are texting and then all of a sudden it becomes a little bit more complex and they want to talk to a health assistant or a nurse, all they do is click to convert that conversation, and now it becomes a telephonic exchange between that member and that nurse or that health assistant. So everything is meant to work together. Everything that the member is doing that in the portal or in that messaging app is immediately showing up in our platform for our nurses and health assistants to see and support that member. Next slide. I like this slide because it does show you that the engagement model that I talked about works. And when I talk about, our model is purpose-built, it is showing you, this slide is showing you our ability to really successfully engage with members across all spend bands. This model creates engagement with the employees and their family members, again, 30 to 60 days before traditional carrier models. And just imagine, what you can do if you're able to get to a member before a claim is ever received. So you might be asking yourselves, well, how do you measure engagement? We measure engagement at Accolade as really a phone conversation or a messaging exchange with the member or on behalf of the member. So it has to be we talk to the member, they respond back to us for it to be considered any kind of engagement with that individual. Let me walk through this slide to orient you a little bit. The numbers that you see at the bottom of each of these bar charts are really the spend bands for that family. That's how much money that family has spent. And then what you see in the blue bars, the percentage on the top, is the amount of engagement we have with that family. And the black bars are the amount of engagement that we have with the providers for those individuals. And then that green line that you see going across is our total contacts. So you can see, even with individuals that are not spending a lot of money on that left-hand side, we're still talking to them 2 to 5 times a year. Whereas those individuals that are spending a lot of money, we're talking to them at least 23 times a year. So you don't get these results unless you can unbiasedly guide members to care that is best for them and enhance that engagement model that's really putting that member at the center. So while our nurses are really involved in an intensive level for these individuals on the right-hand side, we're also involved with the members on the low end of the spectrum. And we are involved with them because they could become your high-cost claimants tomorrow. And those middle spend claimants that you see in the middle, these really may not be on anyone's radar. They haven't been flagged for chronic condition management.
Oh, I think we might have lost Donna's audio for a moment. While she's connecting, there's actually a poll that we were planning on running for the audience. So Donna, go ahead and keep connecting, and we'll launch this poll real quick. I'm actually going to hit two of them here. The first one we're wanting to figure out is just size of the companies that you guys are from. So if you wouldn't mind, just use your mouse there and just click on the company size. That's actually maybe helpful for Donna in the information that she's relaying over to you.
Thank you, Tyson. And Zoom decided that I should not be in this presentation and just hung me up. So glad that I could join again. So I appreciate you doing this poll in the meantime.
Yeah, no problem. I think we've all learned over the last year or so how to work quickly on our feet and, and use technology the best we can, because it isn't always our friend. But you learn how to get back on quickly, which is probably another lesson we've all kind of figured out along the way.
Oh yes, we know definitely where to go and get back on pretty quickly.
Awesome.
Okay, are we ready?
All right, I'm going to close the poll off. Yeah, go ahead and we'll just go ahead and do this first poll, which is just size of companies, which most of the people on are with companies over 100, up in some even up to 1,000. So I'll just mention that and keep going, and we'll jump back to the second poll once you're done with this slide.
Okay, perfect. So looking at this, those middle spend claimants I was talking about that really, are usually not on anyone's radar because they are not being flagged for disease management or anything else. We're helping those individuals with benefit navigation, understanding what benefits they had, how to optimize using those benefits. We're helping triage any symptoms they had so that they're getting to the right level of care. Instead of going to the ER, they're going to their primary care physician, or they're actually doing self-care at home. And then we're providing that treatment decision support to help them understand all the treatments that are available based on their need, and then helping them prepare for that discussion with their provider to determine what's the best treatment for them. But more importantly, with those low spend and with those middle spend claimants, more importantly is that we're building trusting relationships with them. We're building those relationships, we're showing our value for them so that when they do have a health need, they will reach out to Accolade and engage with us. But we're also engaging with their providers on a lot of different topics. I'm going to talk a little bit more about that in a future slide, but I just wanted you to see all the different ways that we are working with members. And then we do have another poll question that I wanted to ask here. And Tyson, if you want to bring that up. When you're looking at those low spend families on the left, tell me what you think, how you think we're helping those individuals. I often get asked, well, what are you doing with people that are not spending a lot of money? So I've given you some options here, and I'd love to understand what you guys think about how we're supporting those low spend families. And Tyson, let me know when you have the results.
You bet. I'm going to run this for about 30 more seconds, and then we can illustrate the results here in just a little bit. So we're about 30 into it. So if you guys can, just go ahead and click some options or what you think the right option is there. Don, it looks like the answer really is coming out is all of the above is what people are answering to that question there.
Then that tells me you guys have been listening to me, because that's exactly the right answer. It's helping those people understand their benefits. It's helping them find providers. It's triaging their symptoms. Yes, that's what we want to do with those low spends. So again, to start building that trust with them and showing our value for them. So let's go to the next slide, Greg. So I've talked a lot right now, but I really haven't gotten into the model of what we do. So let's start talking about our comprehensive model. And it does provide that population health management for all your members. It optimizes the investments you made in other programs and services. And it really provides members with a holistic path to improve their physical health, their emotional health, as well as their financial health. We really become that front door for all your care and benefit needs for both members and providers. Providers call us too to get support for their members. And we become the number on the back of the insurance card for that member and that provider to call us. So basically what we're doing is saying, we are providing that member service support for your members and their family members, as well as supporting those providers. Each family is assigned that personal health assistant and that registered nurse. And you hear me say a lot about families because we really look at the family dynamic at Accolade, because we know that there's usually one person in the family that makes the decisions, but that might not be the person we're calling, or that we're calling, or they're calling us. But we want to make sure we're engaging and understand the context of the family. How does the family make care decisions? So we really do have a family-oriented approach. Members can reach us again via the phone, mobile messaging, portal, whichever way meets your members' needs. They, we often find that members like our messaging app after we started engaging with them, and we have a nurse engage with them, because they, send text messages back and forth to our nurses. Sometimes they'll send us pictures of provider bills because they've gotten a provider bill, but yet they haven't gotten an explanation of benefits. So they're saying, do I need to pay this bill or not? Sometimes they are sending us pictures of things that, a rash, and saying, hey, is this something I need to be worried about? So they really do use that messaging app to fit their needs. And one other thing that's important for you to know about Accolade is we're not just focused on the medical benefits. We really focus on all of their benefits. So any employer benefits that you may offer. Think of your EAP. Think of any telemedicine you may have. Any short-term disability vendors, 401k. All of that information is entered into our system so that we are able to fully support that member beyond just their medical needs. Our frontline care team, which we call our health assistants and nurses, are there to provide that personalized support, but they also are backed by very intelligent platform that helps them know a lot about the member before they even start talking about the member. So we have access to pharmacy claims, medical claims. We have access to utilization management events that are going to happen with that individual. So we really see a lot on the member before we ever talk to them. On the right-hand side of this slide, we cast a very wide net to really capture member engagement opportunities. So we look at the bottom of this slide. This is where we see the most opportunity for early engagement and trust building, is when a member is exploring their benefits and they want to know a little bit more about what their benefits are. Or when we're working with them to understand a claim that they may have, they've gotten an explanation of benefits now, or they've gotten a bill and they don't understand, well, why am I having to pay anything when I've already paid for my insurance? So helping them understand that and removing that confusion and frustration that can often happen when you get an unexpected bill is really important for us in starting to build that trust. Then we provide those personalized referrals to support the programs you put in place. And our platform is able to connect with over 400 plus industry partners to really make a single sign-on, data transfer, everything very easy to your employees. So when they click on the 401k link, they can go right into your 401k vendor portal. So we try to make it very, very simple so that the member is not having to go outside of our portal to access things. Having a health assistant remind you, that you have a telemedicine. When you're sick, helps keep people out of the ER. We know that if we can get them, access to a physician right away, that helps people get better quicker, and it helps people stay at work and deliver savings for both the employer as well as for the employee. Our care management programs really are focused on all conditions. So think of catastrophic needs that the member may have, complex needs, chronic conditions. It's very comprehensive so that we can support the member regardless of where they are in their healthcare journey. And because of all the data that we have and we pull into the platform, we also can provide quality and cost insights for members that are planning to use care. So helping them know what is the best provider to go see based on your healthcare condition, and what is it going to cost you to see that provider? What should you expect to pay? So we're getting members to the right provider from the very beginning, and really avoiding a lot of the errors that can happen when people choose wrong providers initially. And finally, our provider interactions really allow us the opportunity to coordinate care on behalf of members. So we use provider calls where they're verifying the member's benefits, or when they're verifying the eligibility for a patient of theirs. We use those as early care signals to then reach out to that member and engage with that member about their upcoming visit, so that we can help prepare them for that visit. We can give them questions that they should talk with their doctor about. And we also help them know what they should be sharing with their doctor, so that that 15 minutes that they have with their physician is really engaging with that physician in a productive conversation. While we also do utilization management, what we look at utilization management is not just as medical necessity, but it gives us the opportunity to work with providers, but also work with the members who are receiving the care to make sure that, again, they're prepared for the event that they're going to have. So we know that events are usually really late in a care process. It's very hard to change someone's mind on what they're going to have done when you're now pre-starting that service with a provider. So we really need to get way ahead of that event. If you go to the next slide. You're probably looking for some results. These are the first results I'll share with you. And really these results on this slide demonstrate that effectiveness of our team to really make those personalized referrals based on the members' identified needs. So members don't even have to remember they have these services available. And what we find is they don't even remember they have them. So it's not like they've got it in their mind, oh, they got telemedicine, or they've got an EAP, or they've got a Center of Excellence program. We serve these up to the member at the appropriate time, so they don't have to.
Oh, you're still muted, Donna.
Okay, can you hear
Looks
me?
like your audio. We got you.
Okay, I am switching to computer because this is the second time that the phone has stopped me talking. So I have just switched to the computer audio. So as long as you can hear me okay, we'll go with this. Good?
Yeah, you're good to go.
Okay, yep. Okay, perfect. So this slide is really showing you the advantage that we have of really optimizing the programs that you've invested good money into and making sure people are using those programs. Next slide, Greg. It all begins, though, we know, with hiring the right people. So behind every Accolade interaction that you have with us, you're going to find a very compassionate person. You're going to find a health assistant or a nurse that is there for your employees when they just really need to have a friendly human voice that's helping them make sense of this healthcare situation. We really believe that to provide this great service that we do and to drive better outcomes, that we've got to hire smart people, caring people, passionate people, people that I call wired to serve. They just really like serving people. So our hiring process is very rigorous, as well as our training, but it's all necessary in order to bring people on board with the right mix of that professional experience, but also the life experience. People who have interpersonal skills that you can't teach, people who have critical thinking skills, which you cannot teach, and that empathy and just passion for wanting to help others. All of this is essential for a relationship-based service, which is what Accolade provides. We hire individuals that come from a very wide range of services. Our nurses come from hospitals, they come from provider offices, they come from home health environments. We have our health assistants who may come from health plans, from a social work background, so they're licensed clinical social workers, or they are coming from an education background where they've been teachers in the past. So we're really looking for that professional environment and that life experience that we think that combination makes the best people to provide this service. And because we are understanding the complex needs and the diverse needs of the populations we serve, we do a lot of upfront gathering of information about your population. And our team reflects that diversity in our roles, in our life experience, and our demographics and expertise. So our diverse workforce is really comprised of about 33% Black, Indigenous, and people of color. And of that, 54% are Black. This diversity matters a lot to Accolade. As you know, research has shown that patients get better care when they work with a caregiver of the same ethnicity and background. So we really put a lot of attention to the people that we're hiring so that we are finding individuals that really do match the diversity of the population that we're serving. Also, our development efforts have been focused on embedding that social determinants of health data, not only into our processes, but also in our technology to better address the bias that occurs in the personalized care. For example, our analysis shows that members living in higher poverty areas and in single parent households have lower rates of PCP visits. But our data also shows us that members living in higher minority areas have, are engaged with Accolade a lot higher. So that shows us that, that we're using the information that we have and we're engaging with that population that needs our support. And it really allows us to design these custom outreach strategies to counter effect some of that social determinants of health impact on health outcomes. So in addition to a member's dedicated nurse and health assistant, they also are supported by a multidisciplinary team that you'll see on the left-hand side. This includes our Accolade pharmacists, our Accolade physicians, and then we also have specialty clinicians that are there to support an individual with their personal clinical condition. So think of a health assistant and nurse supporting a family, and then one of the family members may be diagnosed with cancer or may become pregnant or may have a behavioral health need. We want to make sure that individual is getting that specialty clinician support through that episode of care. So we do have specialty clinicians that we bring in to the multidisciplinary team to support those members during that time. We're building trust with each member, and we build trust using our influence model that we train everyone on. All health assistants, all nurses, anyone that's going to be touching a member gets trained on our proprietary influence model. And our approach is very unique. We've actually had our approach tested, and we've had results published in a journal that indicates that the way that we are approaching members, the way we're listening to social determinants of health and bringing that into our care plans is very different than compared to other provider groups. So we're incorporating 93% of those contextual barriers that we're hearing right into the care plan, which really leads to a significantly higher rate of adherence to our care guidance. And also does help us start to build that trust with that member. And this is evidenced by, the 73% of members that we talk to, we have repeat engagement with. So obviously what we're doing to support that member is effective, that they're wanting to repeat their engagement with us for other needs that they have. Next slide, Greg. Let me talk a little bit about our care philosophy. Our model from the very beginning was meant to understand what the individual's needs are and make sure we're getting them to the right nurse and getting them to the right care that they need. While a lot of the industry we know focuses on those high-cost claimants, we understand that our clinical model is designed to get in front of healthcare decisions early before anyone becomes that high-cost claimant. So we can be there and help guide their decision making. And we use the data that we gather from the member calls that we have, the provider calls that we have, as well as the claims information, biometric information, really as a way to then engage that employee and that family member so that we can then start helping them make those right decisions. building that relationship with them and exceeding their expectations and demonstrating we really do care about what's going on with them. And that may be in the form of scheduling a doctor's appointment with a high quality provider for someone who needs care. Or it might be contacting their provider for someone that tells us that they're not taking their medications because the side effects of the medications are too much for them. So let's contact the provider and discuss alternative meds that member can take. Or it might be offering to get them connected with a leading specialist. They just got diagnosed with cancer. We want to make sure we're getting them to a cancer oncologist specialist that really focuses on their type of cancer before they make that treatment decision. And then the right path, we're not just doing a one and done with these members, we're sticking with that member. We are working with them throughout this whole episode of care to not only help them with their decision making, but also making sure they're getting the care they need, whether that's medical, whether that's behavioral, it doesn't matter. We're just making sure that they're empowered with the knowledge that they need and the right providers that they need, so that there is an ability for them to engage in shared decision making with their provider. The next slide. Accolade replaces all the clinical programs such as disease management, case management that may be offered through your health plan partner. And we provide all of your members and their family members with comprehensive clinical support. We've got a rich set of data that we're using to support the individual when they call us, but our technology is always scanning data, and it's looking for indicators that someone needs our help. So if we see someone that's going to have an inpatient admission, if we see someone that may be pregnant, if we see someone that's driving high costs, we're going to proactively reach out to that employee or family member to start having that conversation with them. Our system works by, first of all, placing an alert on the dashboard for that member so that a health assistant and nurse knows this is a member we really want to talk to. And then it creates a task for the nurse to reach out to that individual. That inpatient admission I talked to you about, that's really, we want to get ahead of that admission so that we can help prepare them for that admission. Know what to expect when you're going into the hospital. Contact them during the hospital to see if they have any needs and start thinking about their discharge plan. How do we help get things in place if they're going to need home health, if they're going to need any kind of durable medical equipment? How do we make sure we get in front of that and make sure that's in place so that the member can be discharged in a timely manner? And then remove any barriers that may prevent them from being compliant with their treatment plan. So think of someone that's post-discharge and they need to go back in for their physician visit. Well, do they have the transportation to do that? Do they have a caregiver that can help care for them once they're discharged? Or is there any knowledge gaps in their treatment plan or their treatment discharge plan? Just making sure that they are equipped with everything they need to be successful and not to have a readmission because of a lapse in knowledge or lapse in compliance. I often like to tell stories. So I'd like to tell you a story of an individual that we had that was one of those individuals that never show up on anyone's radar. This is perfect person, was healthy, went on an annual vacation that she does with her girlfriends every year. She began experiencing symptoms of appendicitis. So she went to the ER. It was determined she needed to have her appendix removed. So she had the surgery. However, when they removed her appendix, they also found a mass, which indicated to them that she probably had a rare type of cancer called goblet cell carcinoma. When that facility contacted Accolade to make us aware that she had been admitted to that facility for an emergency appendectomy, that immediately triggered us to get engaged with that member. So we are reaching out to the facility to talk with the member after her appendectomy to reassure her that we're going to get her to the right provider, the right oncologist that specializes in goblet cell carcinoma, because that is not something that every oncologist does. Let us find you the right provider that does this, and then let us get you set up with a second opinion before you have any treatment completed. So to make sure that you are comfortable with the decision that's being made on your care. And this was an individual, like I said, had never been sick, really, was like to make decisions on their own, but really appreciated us giving them the information they needed to be able to do that. That's just one of the ways that we work with individuals when we know something's going on. But people call us all the time too. We had an individual call us from the parking lot of a hospital one time, sitting outside of the parking of an ER. They had dropped their kids off that morning because, at school, and they went straight to the ER because of back pain that they'd been suffering for about a week, and it wasn't getting any better. So the patient went to the ER, called us to find out, well, what is it going to cost me to go into this ER? So we were able to tell him what his copay was going to be to go into the ER, but our health assistant was also able to convince him to talk to one of our nurses to see if he really needed to be seen at the ER, or could we get an appointment with the PCP to see him that day? So our nurse did a complete assessment with him, and based on the answers that the member provided to us, we knew we could get him into a primary care physician for what he needed. And it would cost him $20 for that versus $250 to go into that ER. So the member was ecstatic that, hey, can you get me into a PCP? So while the nurse was talking to the member on the phone about their symptoms, we actually had our health assistant contacting physicians to get him an appointment that day. And that's the work that we do on behalf of that member and show it value. And this is when I talk about influencing care decisions. You have to go beyond what a typical person would do. And you have to think beyond that and say, how can I create value for this member? So that's what I mean when, I talk about building trust, and caring about the member, that's what we do. If you want to go to the next slide, when we're engaging with members, I told you earlier, I wanted to talk a little bit more about our impact that we have with that. So when we're providing the information they need to make good decisions, when we're addressing all their care needs, and supporting them through that episode of care, these are the kind of results that we see. We see an increase in appropriate utilization with behavioral health. We see a decrease in avoidable ER visits. We see, a decrease in 30-day readmissions and avoidable admissions. So really what work we have done since 2009, since we first started offering this service to employers, we really have been very consistent in the outcomes that we provide, not only in clinical outcomes, but also in savings. The next slide. We know, though, it's just not enough to engage members. We know we have to engage their providers. So we do make it simple for providers to call us too. Accolade providers call us to verify those benefits. They call us for to pre-cert services that member may need. We do appeal management with that provider as well as with the member. And we do, offer the same quality, the same expertise that we provide to our members, we provide that to our providers. And we use these provider interactions not only to collaborate on that individual's treatment plan, but we're also using it to engage that member. Again, what we learn from the provider just helps us to know more about that member so that we can support the member better. So I've got one other poll question I want to ask you, pretty simple. If you could tell me how satisfied do you think the providers are with our services? And then Tyson, if you can let me know when you have the answers.
You bet. Yeah, we're collecting the answers right now. Yep.
Okay.
We'll just give this another 5 seconds or so.
Okay.
And it looks like the answers that we've gotten so far is between 85 to 90% on the satisfaction.
Okay, it's actually, I can see why you would pick that because, you wouldn't expect the providers to be overly happy with us, but they are. Our provider satisfaction measured by providers is 95%. So, and a lot of that comes from, I can tell you, I worked at a Blue plan for 15 years. And I can tell you, we did not answer our provider calls in the timeliness that we do at Accolade. So, I think a lot of that goes to providers are calling us. We're picking up the phone right away. They're not having to wait. We're not telling providers that you can only call in, once a day and give us all your pre-certs. They can call us as many times as they want a day. So just doing some of the things that are different than a traditional carrier would do has really pleased the providers that we work with. They really enjoy working with us. Next slide. So delivering personalized healthcare really takes the efforts of the entire organization. We work together very tightly. We are accelerating in a space that really doesn't slow down. At Accolade, I can say this: we never sit still. We're always looking to innovate, even during times of change like we saw in 2020. Accolade invented high-touch, high-tech advocacy back in 2007. And we spent the last decade just perfecting what we did back in 2007. And it really, is an advocacy company that the industry really aims to emulate today. While I say a lot of people copy us, that copying really just tells you you're doing the right thing. So we like to hear when people are saying some of the words that we came out with and doing some of the things that we said need to be done, because that's the only way we're going to change healthcare, is if everybody gets on board and does the same thing. But 2020 came with a lot of different events, unplanned events for all of us. And when the life changed dramatically for all of us, we quickly began to innovate in making sure that people were going to be able to still get the right care that they need at the right time. So we mapped that challenge of COVID head on and continued to deliver unprecedented growth and innovation during that time. So some of our achievements last year included incorporating intelligent provider matching, which helps members find doctors with experience with patients just like them. We have a lot of data that we use today to really narrow down not just the specialty of a doctor, like an orthopedic doctor, but really the subspecialty. If we need an orthopedic doctor that focuses on hips, or if we need an orthopedic doctor that focuses on knees, we want to make sure we're getting that member to that orthopedic provider that has that experience. We also launched a very comprehensive solution that we called COVID Response Care. It was really focused on helping employees return to work safely. And then we also implemented a new mental health integrated care offering, which provides on-demand behavior coaching, psychology, and psychiatry visits to address the emerging health crisis. And it's delivered in a virtual setting and to meet the new demands that we now are living under. Our appropriateness of care measures looks at more than 80 measures, and it ensures that a provider is providing the right level and the amount of care that we would expect for them to do. Like, we look at things like the number of C-sections that are performed, the rate of knee surgeries that are performed versus alternative treatment. So we really use those appropriateness of care measures to ensure that providers are delivering that right care. And then this year, we've added 2nd.MD, our expert medical opinion, and PlushCare offering, that virtual primary care, to the services that we provide to our customers. And what we always say is, you need an advocacy partner who's going to innovate with you. And Accolade has proven over the years that we can do that. So in summary, our role, the role of our health assistants and nurses, is always to follow the member and really work to see the world through their eyes, while also maintaining that objectivity that we need to always get them the care that they need. So I really appreciate your time today and allowing me to tell you our story. I hope I didn't speak too fast. I am from the South, but I really can talk quick. So I hope I didn't speak too fast, and I'm going to open it now for any questions that you may have.
Yeah, I appreciate that, Donna. And I don't think you spoke too fast. That was perfect. Thank you. So I do have a couple questions. I was kind of curious, and maybe some of them might just be just emphasizing some of the things that you had said before. But the health assistants and the nurse, I think was what you were calling them. where they're really the people that are doing a lot of the main work. So how does a family know who their care team is? Like, how do you actually assign them? Is there, I think you even mentioned just different demographics and
Yeah.
making sure that you've got some different people to help out.
Yeah. So the first time we talk to a member, that very interaction, they're assigned that dedicated health assistant for them and that family right at that first interaction. However, it doesn't mean that, you know, that the member couldn't change to a different health assistant if they wanted to. But that's how we do it today. Is first time we talk to you, we're going to make sure you get that health assistant. The next thing we're going to do is anytime, the first time you need have a care need, we're going to assign that nurse to you and your family. So we're really making sure that you've got a partnership between that health assistant and nurse, and they work in a very tightly coordinated manner to really support that member for either their administrative needs or their clinical or care needs.
Okay, that's great. And I can't remember if you mentioned this or not, but are the folks over at Accolade, are they helping also with non-medical benefits too?
Yeah, and that's a differentiator for us. If you think about carriers, they really are focused on the medical benefits for that individual. But again, we focus on medical and non-medical. So we pull in all of the customers' ancillary benefits, including dental, vision, leave and disability programs, employer-sponsored wellness programs, point solutions that they might have, such as EAP or telemedicine. All of that is loaded into our platform. So it's easy for our health assistants to really educate members and help them access those services in their time of need. And the same thing happens on our mobile application and our digital portal, that, you know, the benefits hub is there also. So these services are available for the member to actually see and access pretty easily.
I love the that chart where it shows the rate of engagement, and to me it was pretty amazing to see that it was such a high engagement. I mean, you expect it on the high utilizers with the really expensive things, because they've got a lot of questions, need a lot of help. I think it's probably much higher than industry though on how much you're even engaging them. But why is it that you see so much engagement on the lower end as well? I mean, what are people calling about, or how are you getting them to talk through whatever's going on with them when it's, you know, a claim that's $1,000 or less?
Well, I mean, if you think about the industry, a lot of the industry is really reacting to an event. They are using, you know, predictive modeling to find someone after an event has already happened. And Accolade's model is really intended to be proactive. Rather than waiting for a member to become that high cost claimant, we really want to support the individuals to help guide that decision making, so they're making the right decisions, and we're empowering them with knowledge so that they use care wisely. And that's the only way we feel that we can really change that healthcare trajectory and reduce total costs. So, you know, while our technology is helping us find those clinically impactable members, we want to make sure also that, you know, we're working with those individuals that might not have a need today, but may have a need tomorrow. So it's really important for us to begin showing our value with any administrative questions that they have, so that they will turn around and call us again when they have a care need.
Yeah, that's great. And it's probably helpful that you're not just going at it from the medical only angle, right? So you're trying to get to these guys in a lot of different directions as well.
Yes.
So one thing, I don't know if you mentioned this, but how do people work with Accolade? I mean, because, you know, if you're fully insured, is Accolade an option, or do you have to be self-funded to be able to work with you?
No. You know, we work with the individuals that are, we have some fully insured populations, but most of our customers are self-insured. And so, you know, we work with those individuals to really identify, those customers identify what they need and to provide those services based on what they need. We're very flexible. We know some of our employers have carriers that want to continue to hold on to utilization management. They want to continue to hold on to utilization management. We're flexible in that they do that, and we'll just provide the clinical management services. And we develop a partnership with that carrier to get that utilization management data that allows us to then engage with members. So we've always established ourselves as a very flexible advocacy company that wants to work with all types of employers.
That's great. I'll give you an example of something that just happened to me this morning. I had a client that texted me and said, hey, I've got an employee asking right now, they've got to get an MRI. They don't have a lot of money. So like, what's the cheapest and best place for them to go to get that done? And so we helped with that or whatever. But how does Accolade do that? I mean, what's the process using the technology, or how do you find those high quality providers that are not gouging you on price?
Yeah, we've got a very robust provider set that we use to find the right quality provider. And when I say robust, I'm talking about 14 billion claims. And majority of those are commercial claims, which really are relevant to the population that we serve. And it's about 255 million patients. It covers 95% of providers nationwide. So our methodology is really looking at 5 pillars. The provider experience. When I talked about, the orthopedic provider, we want to know the procedures that a provider performs. We want to know the conditions they treat. We want to know what diagnoses are most prevalent in their clinical profile. And then we look at that appropriateness of care measures. So we want to make sure we're referring members to providers that are providing the right level and the amount of care and not underutilizing or overutilizing care. And then we look at their outcomes. We have access to look at, how well these providers do on length of stay, on complication rate, while they're in a hospital setting. How well does their patients do? And we can compare these providers against peers, their peers that also do the exact same kind of procedures, and see who has better outcomes. And then we want to make sure that we are personalizing the provider that we're choosing for that member. So we really look to understand from the member's perspective, are they looking for a female or a male provider? Are they looking for someone close to their office or close to their home? We want to, do they want to see a provider that sees a lot of patients in their age range? So really more trying to get them to a provider that looks like them. And then cost transparency is another thing that we want to make sure we're looking at. We want to make sure people are going to a provider that's going to charge them a fair value for whatever tests, visit, procedures, whatever is going to happen. So we look at that fair value within that patient or that member's geographic region to identify the right providers that are offering the right care at the right cost. So it's 5 different things that we're looking at before we ever choose that provider for that member.
That's great. So Randy, I don't know if there was anything else you wanted me to cover, but I really do appreciate the time, Donna. This has been awesome to relay this information and make people more aware of what's out there, because I think within care management or utilization management, it's just assumed that whatever they're given is kind of the choice that they have. And that's not really the reality. They can work with a company like Accolade and really do more for their members and help with their costs too at the same time.
Well, thank you so much today for this opportunity. I really do appreciate you giving us this time to provide our story.
Cool. Thank you so much.
Okay.
Have a great day, everyone. Bye-bye.
Thank you.